Welcome everyone to the Homeless Solutions webinar series. You guys rock. Thank you for taking the time to be here. So many people on this call, such a commitment to doing something about the unsheltered folks that are out there. Oh, I see Diaz sent a nice little heart up. That's nice. Um, I thank you. I thank you for those of you who are working in the community doing this work. We're grateful to have you as partners. My name is Tom, and I serve as CEO for OPCS, which was formerly known as Old Pueblo Community Services, and people usually just refer to us as Old Pueblo, right? So, this is one of the more fun tasks I think that I have is to introduce folks to give these brilliant presentations in the community. So today, I'm very grateful that two of the smartest folks that I know are going to be talking today about homelessness in Pima County and in Tucson and unsheltered work. The other thing, though, that I'll say about both of these folks is that they are some of the most compassionate people I know. And it's not often, that you run into folks who are both really smart and really compassionate. And when you do, I tend to want to make them colleagues and friends. So Keith is with University of Arizona, Southwest Institute for Research on Women, also known as CIRO. And Kat is at the helm of the wonderful Tucson Pima Collaboration to End Homelessness, also known as TPCH. And today they're going to talk about something that I think is really interesting, just in the title, that I think they probably put this in this title and in this work intentionally, which is a human-centered community-wide housing and homeless strategy. I'm sure there's strong intention on this idea of being one community wide and two being human centered. So not to take away all the surprises of their slides and their work. I'll let them, provide any more information if needed about themselves. And in the meantime, if I'm not forgetting anything, which I've been known to do, I will let them take it away.
Thank you so much, Tom, for that incredibly kind introduction. We really appreciate it. Um, Welcome, y'all. I just want to echo Tom's expression there of appreciation to everyone on this call. We really appreciate you taking the time today. I'm Keith Bentley. I'm Associate Research Professor at CIRO. I'm also on the TPCH board. I'm also the co-lead of this Community Coalition for Prosperity Housing Workgroup with Kat Davis. And I'm also the lead of the TPCH System Performance and Monitoring Committee. Kat, you just want to introduce yourself?
Sure, yes. Thank you so much for having me here today, and for, again, that kind introduction, Tom. So my name is Kat Davis. I'm the COC lead team manager for the city of Tucson, and so my team supports the work of the Tucson Pima Collaboration to End Homelessness, and as Keith mentioned, co-leading the CC4P Housing Work Group with him. So I will hand it back to you, Keith.
Thank you so much, Kat. And right at the start here, I want to start on a note of humility. This is a pitch. This is an invitation to join us in this work. And this is very much a request for guidance and feedback. There are so many experts on the call here who have a really deep understanding of our system, have a really deep understanding of how to do collaborative community work like this. So please know that our feedback is welcome. We don't think we're doing this perfectly, and we really want to better understand how to do this work most effectively, and being mindful of all the challenges that everyone is negotiating at the moment. Okay, so very quickly, there's a packed agenda for our small hour here. I'm going to start with just a quick update on what's going on with homelessness locally. I'm going to talk a little bit about why I think this is a real important moment for a community level response to reduce homelessness. We'll have some folks describe some ongoing efforts like the Prosperity Initiative and the Community Coalition for Prosperity. Some of you may be very familiar with that work, But the hope for this recording today is that this is something we can use down the line to help invite people, bring people into this effort, and hopefully get them oriented, because there is a lot going on, like an enormous amount of stuff happening in our community in this space, and it can be quite overwhelming. So today I'm trying to just do some table setting, give people a sense of the lay of the land about all these different ongoing efforts. We'll talk a little bit about the vision for what this work group hopefully will accomplish. We're going to get right in today to some of the big problems in our system. I have a line I keep saying that we don't need any more needs assessments. No more needs assessments. We really know where things are breaking down, and I think we have plenty of work to do focusing on those known gaps and barriers. Some of those are identified in TPCH's strategic plan that Kat will give a very high level overview of for us. And then at the end, we'll be sort of looking for directioning about modality, how to do this work going forward, and an invitation to participate in either the leadership of this work group or in some of hopefully the smaller work group committees that will form around specific gaps or problems in the community. So we'll just launch right in. This is my quick update on what's been happening with housing and homelessness. So as many of you are aware, we had a very dramatic increase in home values in Tucson Pima County following the 2020 pandemic. This happened nationwide, but this also happened very strongly in our community. Since roughly the end of 2021, home values have kind of peaked and crested and have been moving sideways. That is good in the sense that they're not getting worse or homes are not getting more expensive, but it also means the values have plateaued at a level that is very high and very much out of reach for a lot of low-income households in our community. What that has done is it's caused a lot of folks who traditionally, historically, would have moved out of the rental market into homeownership are no longer making that transition, which means there's more demand crowding on our limited housing supply, and particularly on our limited rental housing supply. That's a major driver, amongst other factors, of the very dramatic increase in rents that we saw between 2020 and 2022. We had a roughly 35 to 40% increase in average rents over this period. And while rents have stabilized, which is good, they've stabilized at a level that is still very high for many of our lower income households. And so housing cost burden, which is how much you spend on housing relative to your income, is at very high levels for our community. And is one of the reasons for ongoing housing instability and high rates of homelessness that we're continuing to experience locally. This is the rental vacancy rate. A rental vacancy rate is the proportion of rental units that are available on the market and are not currently occupied. Our vacancy rate hit an incredible low of around 4% at the end of 2021. And then we have recovered quite substantially to an area of more 8 to 10% of rental units being vacant. A vacancy rate in the low teens is generally associated with abundant opportunities, is often associated with lower rents on average. But this is an area of improvement. And so in these hard times, I like to focus on any silver linings or anything that's going right. So this is a place where we have seen improvement in the last few years. And I'll just say more broadly that quantitative researchers who look at homelessness have found that the vacancy rate and average rents are generally the most powerful and sometimes the only local factors associated with different levels of homelessness. So when the vacancy rate is higher, homelessness tends to be lower. And then when rents are lower, homelessness tends to be lower. And often those are kind of the main factors that seem to be associated, which means these are really the structural housing supply factors that are impacting rates of entry into homelessness. Another thing we can look at is evictions. So eviction filings in Pima County over the last calendar year have been in the area of roughly 800 to 1,000 evictions a month. Another way to think about this is how many evictions are happening every day court is in session, which I've provided for you here. And we can look all the way back to mid-2024, and we've been seeing about 40 to 50 eviction filings per day the court is in session. One of the things that's very striking to me about this graph is that we had the pandemic recession in these years, and then we had this very dramatic recovery in recent years, and then very low unemployment in the last couple of years. Despite all of that, we've had very, very consistent eviction rates. And part of this is that economic recovery is not showing up in this. What we normally see is a decline in evictions and a reduced rate of entry into homelessness when the economy recovers, but we have not seen that. And I think that is primarily due to the countervailing pressure of higher rents and home values, making more people housing insecure at the same time. Okay. Turning our attention now to homelessness locally. This is our PIT count data point in time. This is a HUD mandated survey that we do every January. And essentially, if you're not familiar, we count the folks who are in shelter on a single night, and then the next morning, volunteers from our community go out and interview people to count them in the unsheltered count. And so we can see here that the sum of those two counts has been producing a count of about 2,000 folks are interviewed and seen as experiencing homelessness in that moment during the pick count on that one day. There are lots of issues with this that I won't get into now, but I'm strongly encouraging people consistently not to rely too heavily on the pick count. It does provide us information on the number of people who are unsheltered, but it does so in a way that's like very unreliable methodologically. So even if it is some information, it has to be so qualified that often it is not as useful as some other data that we have handy. So what I've done here is I've taken those total counts from the PIT, it's in the yellow line on the bottom, and I think it's a really important contrast to the green line, which is the total number of households that were served, unique households that were served by any provider in the COC continuum, any TPCH provider. And we see that the number of households served over the whole year is significantly larger than the number of people captured on that single night survey, which you would expect, on the magnitude of roughly twice as many households served. And I also want to emphasize that these are only the households that were actually served. We're not able to serve even the majority. We serve a minority of folks who are seeking services. And you can see that most clearly, I think, in the red line, which is the number of coordinated entry assessments. Coordinated entry assessments are the first step for a household experiencing homelessness to access services from TPCH, from our local continuum. And so it's basically a small survey you do. Everyone who does that survey, almost everyone, should be experiencing homelessness. And so this count of unique individuals and households completing this assessment, I think, gives us a rough sense of demand for services amongst people who are seeking those services. But the main takeaway here from my perspective is that we have an enormous gap between the number of people seeking services who are actively homeless and those who are actually served. So that's one major system gap. And the only good part of this I can say is that we have had a modest decline in the number of households seeking services relative to 2023. And so this does suggest like a mild softening in need, but it's still producing a ratio of need to service that is very, very large. Okay, last, here's just one more data lens on homelessness locally. So this is the number of people on our households on our by name list. This is the number of households considered actively homeless in the sense that these are households who have done a coordinated entry assessment, or they've had a system touch with their provider. So an interaction with their caseworker, an enrollment in a program, or any other kind of interaction that is logged in our data system. If you've had an interaction in the last 90 days, you stay on this list. If you have not interacted with the system, you fall off the list. So many people, and I know most people who fall off this list fall off the list because they are not in touch, not because they are housed. However, if you move into a permanent housing situation, that is another way that you exit this list. So with that in mind, we have roughly of late 2,500 to about 3,000 households that are consistently in touch with a provider, seeking services, and experiencing homelessness. And so for me, that really helps me get my head around like the volume of like the line basically of households waiting for services. And I'll also just quickly mention that the vast majority of these households are singles. And so the solutions that we need, especially all the way at the end of the permanent housing solutions, are ones that make sense for singles and that singles can afford, or that singles can afford in combination with shared housing context or partners and et cetera. So we really, really do a poor job of serving and stabilizing these singles as they try to exit homelessness. Okay, last, as I mentioned before, unemployment has been quite low and actually low by historical standards in recent years, but this has not translated into positive changes or relief in terms of inflow into homelessness or a reduction in evictions. And again, I think this really speaks to the precarity of our current situation, because we have basically record inflow into homelessness during a period of uniquely low unemployment. So this is like the best case scenario in terms of the American economy, and things are still looking relatively rough. And obviously we have potential fluctuations in our economic situation looming ahead of us. Okay, now I'm going to talk a little bit about what I think is the case for a community response. So I'm going to move quickly here, but I will just say personally, I feel intense frustration with the lack of federal and state action on this issue. I am sick of waiting for the feds or for the state to step in more aggressively here. And I think the lack of action, and actually I would say some of um, the threats of cuts that are looming really, really make a strong case for a stronger local response. And that means coordination, but it also means funding. And so I think this is really creating a moment where really no one else in the near term is going to be stepping up. And we really have to look to our community and our local leaders to get more done. I also want to say that there is a lot of exciting stuff happening around funding for affordable housing, zoning changes that will allow much more middle housing and more affordable, denser housing. These are wonderful, but these are also long-term processes. And especially things like zoning reform, it takes a very, very long time for that to kind of trickle through our housing stock. And it's also very expensive to build and develop right now. And so I, like many people on this call, I'm sure, experience constant stress and distress about the situation that people are experiencing who are unhoused. Every season coming and going, the summer's coming, we start worrying about people dying. The winter's coming, we start worrying about people dying. The brutality that our caseworkers and people on the front lines have to see day to day with people, it's just incredibly frustrating, and the trauma is so deep. I think we can do much better. It doesn't mean we get everyone into homes immediately, but I think we can do an enormously better job in terms of reducing harm and like reducing the intensity of the situations that people are in as we wait for those larger housing supply problems to get fixed, right? As we wait for that housing supply to be filled back in. Okay, we also have some looming threats. We recently saw that the federal government HUD is very interested in cutting programs, and in particular interested in cutting permanent supportive housing. This is one of our most undersupplied interventions, and it's also expensive and something we really need. And so that is a very alarming thing that we need, I think, to start thinking very proactively about as a community. And then we also have this issue of the economy is very likely entering a slowdown. This is jobs added per month going back to 2021. We can very much see a reduction in job growth. Danny Nee, I don't know if he's on the call, but he has teased me publicly a few times about how I've predicted 4 of the last 2 recessions. I'll take that. But regardless of whether or not we're entering a recession or not, we are definitely entering a slowdown. We also know that unemployment has been creeping up in Arizona. A full point increase in a year is quite noteworthy and really suggests that the labor market is softening. And we also know that lower income people are most likely to be first impacted and most heavily impacted when the economy slows down. So that will increase the acuity of housing insecurity and the likelihood of people entering homelessness. Okay, we also have a lot of very known choke points in our system, places where the system is flowing and then it kind of hits a brick wall, or we see a lot of the effort invested in folks falling apart because certain parts of the system are not in place. I'll save the details on that for later in the conversation today. But I mentioned that just to say we know a lot already about what is going wrong, and we don't need a study. We don't need another needs assessment. We really know where we can start work. And so I think this is again a moment to really just move forward on solutions and spend less time talking about what to do. Last, there is so much action happening from the local government at the county and city around housing and around homelessness response. I think there's a lot of expertise on this call from people who are not at those agencies, who are not in the local government, folks who have lived experience. And I think we have some really amazing best practice models that are being implemented by some of our providers. And so there are solutions we have that we can scale up. And I think there's expertise that we can really rely upon to guide our local solutions. And so I hope this can be another place to elevate those solutions. And last, I would say, what else? If you want to put stuff in the chat, other reasons why you think it's good to move now. That's kind of just for fun. If anyone wants to chime in there. Okay. Next, I'm just going to talk very briefly about the Prosperity Initiative, and then I'm going to hand it over to my colleague Jenny Grable to talk a little bit about the Community Coalition for Prosperity. Again, this is just quick background for folks who may not be familiar. The city and the county in recent years passed the Prosperity Initiative, which is a anti-poverty policy agenda that seeks to basically reduce the number of low-income kids and poor children from Pima County who end up poor themselves. So trying to break that cycle of poverty and provide ways to reduce costs for low-income families or increase assets and opportunity for those households through all of these different policy areas. So I'm not going to go into like a detailed anything about this, but I will say This has already passed, which is very exciting. And there's a lot of work being done to kind of monitor what's happening with these policies to push it further. And if you are interested in this, there's two really excellent websites at the county and city that provide explainers, infographics, short reports, and then the full policy briefs. If you're interested, I encourage you to look at those. And for today, I just want to highlight that a big chunk of this agenda is related to housing, right? Housing is the most expensive cost for any low-income household. And so reducing the costs of housing is a central goal of the Prosperity Initiative in the hopes that that will increase housing stability and also reduce negative outcomes like evictions and experiences of homelessness. I'm not going to talk through these, but just to give you a sense, these are the first three policies in a little more detail. And basically the goals here are to increase housing supply, prevent displacement from low-income neighborhoods, increase quality of life in those low-income neighborhoods, and increase housing stability. So reduce the rate at which homeowners are experiencing foreclosure, that renters are experiencing evictions, and ideally to reduce subsequent entries into homelessness. Now I will stop talking for a second, and you don't have to listen to me for a moment, and ask Jenny Grable to jump in here and talk a little bit about the Community Coalition for Prosperity. Thank you, Jenny.
Absolutely. Yeah, thank you so much, Keith. Thank you for having me. Thank you, Tom. Thank you, Kat. It's really an honor to be in this space. My name is Jenny Grable. I am the project lead for the Community Coalition for Prosperity. We are a group that was a part of the development of the policies of the Prosperity Initiative and really saw the need to have a multi-sector approach to the implementation of the strategies that were outlined in the Prosperity Initiative, assuring that we really can build a community that is prosperous for all. We cannot just rely on the public sector for the implementation. We have to bring all groups together. Can we go to the next slide? Thank you. So what we're focused on with the Community Coalition for Prosperity is multi-sector systems change. So how can we look at the systems that hold families in intergenerational poverty? How can we create better alignment? How can we build some implementation strategies, which is exactly what we're talking about today when we talk about this human-centered, community-wide housing and homelessness strategy. It's a systems change effort through an implementation strategy that is in alignment with the policy of the Prosperity Initiative that Keith just mentioned. We also have some focus on advocacy. And again, we're really looking to align the broader community with the strategies that have been outlined in the Prosperity Initiative because they are a roadmap that we can be in partnership and in tandem with the public sector on. Next slide, please. So again, I mentioned we have these three unique pillars and three strategies that we're focused on. One is the alignment, which is really about the education of the broader community to really understand what are the policies, what are these policies looking to achieve, and who is already doing this work that's in deep alignment with this, with the strategies of the Prosperity Initiative and these strategies to mitigate intergenerational poverty. So how can we assure that we're aware of what are the social service programs that are already doing this work? How can we build better systems and better collaboration across those entities and also make commitments to work and goal set to do better together? We have our implementation pillar, and that's where this housing working group lives. Keith and Kat are leading our housing working group and are focused on high impact strategic leverage points, which is where this human-centered community-wide housing and homelessness strategy comes in. That is what we are looking to be and what are we proposing as our initial strategic action project for our housing working group. We also have working groups in the areas of health, education, and workforce. And we also have an advocacy pillar. We are deeply committed to elevating the voice of lived experience, our context experts, and making sure that we are aligning our advocacy agenda with what they perceive and what the needs of those living in intergenerational poverty. How do they want to advocate? What do they want to advocate for? How do they want to go about that work? And how can the Community Coalition really prop up their voices and assure that they're given all the tools and the resources to speak their truth in these spaces? The better that we can move into these systems change implementation with the voice of lived experience leading the way, we know the better the systems will work, right? Next slide, please. We have some incredible partners in this work. We are not going at this alone. The United Way we are braiding our resources with the United Way. We've been deeply supported by the Community Foundation. The Water Center for Systems Thinking is helping give us that systems lens and that expertise in systems thinking and systems change. We want to thank Keith and Brian Mayer and the University of Arizona for their engagement in this work. And then we work very closely. We've been working very deeply with the city of Tucson and Pima County. Again, we want to hold them accountable for the policies that they've passed, but we also want to work in collaboration and highlight the collaboration points that we have in the community and the great work that's happening, and be a mouthpiece for the opportunities for the community to engage in the implementation of these policies. Next slide. And then we have some communication strategies. We hold quarterly virtual forums. We have a digital newsletter. We do stakeholder convenings. I'm going to go ahead and add to the chat an interest forum so that you can add, if you're interested in engaging with us, specifically in the housing working group, but really in any way to get yourself on our newsletter and to learn a little bit more about these efforts. I'm going to pop this form into the chat right now. It's a quick, easy Google form that you can fill out. And again, as Keith has mentioned, and I'm sure Kat will continue to share, we are looking for engagement in this. We are not the experts. We are the facilitators. We don't want to replicate what's happening. We want to be connective tissue around what exists in our community and how can we better create collaboration and systems that serve the human beings who we also deeply care about in our community, so that we can have a community where everyone prospers. I think that's my last slide. Yes. Okay.
Thank you. Thank you so much, Jenny.
Thank you.
Wonderful. Now I'm just going to talk very briefly about some of the visions for this housing work group. I am proposing here, and I have already proposed to the CC4P leadership, that the initial focus of this work group should be on homelessness reduction. But I want to kind of acknowledge that there's sort of this is a step on the way to the Prosperity Initiative. So the Prosperity Initiative, as I just mentioned, really focuses on housing supply, increasing the supply of deeply affordable housing and affordable housing stability, and preventing displacement. But the vision of the Prosperity Initiative more broadly is of a community with significantly lower poverty overall. And so in my mind, homelessness is one of the most extreme forms of poverty. It's one of the most extreme forms of housing instability and deprivation. And one of the findings of the 2023 needs assessment of adults experiencing homelessness in Tucson was that 24% of the folks we interacted with had experienced homelessness as a child. So these are homeless adults who were reporting to us experiencing homelessness as a child. And that really made me think about this like intergenerational transmission, not just of poverty, but of homelessness itself. And so if homelessness is this hardest edge of poverty and housing insecurity, then there should be very little homelessness in the context of a community with very low poverty. So I see poverty reduction as a step on the way to creating a much lower poverty community. I know that is extremely ambitious a thing to say. I would invite us all to just put aside our cynicism, just allow ourselves just the smallest amount of hope just for a second. But I really think that this, to me, is a stepping stone on a way to a community, again, with much lower poverty and hopefully much, much higher levels of housing stability. Okay, the work group itself, as Jenny just mentioned, some of this is going to be monitoring and advocacy, right? How do we work in collaboration with local governments to make sure not just that they're doing things, but where does the local government need some support or advocacy from community partners? We want to do some system gap and problem mapping activities. We'll talk about some of that, which has already happened in a moment. I'm really hoping we can form some problem-focused work groups. And I just also want to say clearly, what we end up focusing on, this is going to be a very practical effort. We're going to focus on things that people here or people who join us in the future want to focus on and have the capacity to work on. You can prioritize things ideally in any order, but it doesn't matter if you don't have the people in the room to do the work. And so I'm hoping these problem-focused work groups will form organically of people who are looking to work in certain areas. And I hope that will be a platform for these more community-led solutions. And then the last thing I want to mention is that there is a very, very strong focus in this effort to identify funding needs and to put a price tag on things in a very practical way. And then we will also have kind of staffing and effort to seek that funding. And that could be through advocacy, through grant writing, through philanthropy. There's lots of avenues there that we want to pursue. And then last, I think we can, like I said earlier, I hope we can elevate some more community solutions coming from our community experts and from our really impressive nonprofit partners and people who already have these really excellent programs in place to make sure those are part of the broader conversation. The other thing that is giving me hope is that there is an enormous amount of stuff happening. Now, I'm not going to talk through any of these, but we have a lot going on at the county in terms of establishing more homelessness prevention infrastructure. We have a lot going on at the county and city in terms of affordable housing development. New funding streams are being identified. We have these innovative solutions in the form of like the Star Village or the TPCH Unsheltered Initiative, also known as the Housing Central Command. Really think we have some very impressive best practice models that are scalable and that we would just need to identify funding to scale those solutions. It's not that we need to find new solutions. We have a lot already. I'm hoping that some of the zoning reforms and potentially an emergency housing declaration will give us a little more flexibility to move faster on some solutions. And then we also have the TPCH strategic plan, which I think is very, very thoughtful and well aligned with some of these other efforts. And last, I'll just say we have the Community Coalition for Prosperity, and we have my staff at Zero and myself, because we do have some funding to support some of the staffing and administration between my unit and the CC4P. And so all of these things are usually not in place, in my opinion, and they're all in place right now. And I think it creates a very, very exciting moment. And I'll also just say again, if anyone wants to add anything to the chat, there's a lot of things happening. And so if you think there are other examples of exciting resources or programs that are happening right now, I invite you also to add those. Okay, I'm now going to turn it over to my colleague and co-lead, Kat Davis, to talk us through some of the major system gaps and problems that we know are happening currently.
Perfect. Thank you, Keith. So as Keith has mentioned a couple of times now, we know what the gaps are. We know what the problems are. This is not a time when we need to be doing a lot more needs assessments. But how do we move from assessment into action, actually meeting those needs? So we'll talk more about some of the solutions and the gaps that exist in the system in a moment. But at a high level, increasing homeless prevention in our community, creating more pathways out of homelessness and more permanent housing destinations for people to be housed in. And so this is an image of sort of our system flow. So I'm going to talk through it really quickly to kind of explain all the different moving pieces. So the number of people experiencing homelessness in our community isn't truly known. As Keith mentioned, we have data from the point in time count from our active by name list and other data that we have. But there's also people who are living in their cars perhaps, or couch surfing with different friends and family that are not necessarily captured in that system. So we don't truly know the full demand for people experiencing homelessness. But in last year, in FY25, we had a total of just under 7,000 coordinated entry assessments. So as Keith mentioned, those are assessments of people who are experiencing homelessness, who are seeking services within the system. Of that almost 7,000, we were only able to serve just under 2,300 of them in any project type, which is 33% of the people requesting services. So this is an increase from previous years, but we were only able to serve 33%, which means 67% of people who are requesting services from our system went unserved. So what does that service look like? So if you go over to this little box, most of our people that are being served in our system are being served in emergency shelter. Emergency shelter is not housing, so those people are still homeless, even if they're in shelter, they're just no longer unsheltered. And then we also have transitional housing, rapid rehousing, and permanent supportive housing. I won't get into the definitions of those, but those all have specific sort of definitions and guidelines directed by HUD, and different people are kind of eligible for different types of housing. So those are the different types of housing that we have in the system and the number of people served. So some of the issue with that is that people stay in those, as permanent supportive housing suggests, it's not bound by time. So people may be in that for multiple years. So we're only bringing in about 55% of the people being served in that system that are new, whereas the other 45% are people that are already being served by those. So then as people move on from their housing out of the homeless system and into permanent housing destination, we we only have about 39% of people leaving the system into permanent housing destinations. So that number is quite low, but it's slightly skewed because our numbers out of shelter are very low and our numbers out of housing are much higher. But when you have the average, it's about 39% of total people moving on to permanent destinations. From there, about 8% of those will return to homelessness within the first 6 months. And so that just feeding kind of back, completing that loop back into the system where they are again being assessed for housing. And so let's go to the next slide, Keith. We'll revisit this in a minute and kind of talk more about the different barriers and choke points throughout the system. But you know, that unknown number that we start with, that big purple bubble on the other screen, kind of can represent some of these numbers. So the total evictions and the number of people calling 211 at the state level for housing and shelter. This gives us an idea of additional need beyond just our coordinated entry assessments, but additional people who may be facing homelessness, maybe aren't homeless yet, but are at risk of homelessness. So this data is a couple years old. And as Keith mentioned, we have dropped the number of people who were completing housing assessments, but in FY23, it was over 7,600 people that year, people in households. And so from that huge bubble, you know, only about 1,600 people were served, new people. Just over 1,000 were referred to a housing program, and just over 500 were actually enrolled in a housing program. So you have this huge amount of need, and just a few hundred people that are being served in this way. And so this kind of shows you the funnel of like how big the need is versus how capable we are of meeting that need currently. Next slide. All right, so let's talk about some of the shortfalls in the system. So first off, as we mentioned, the number of people seeking services completely overwhelms what the system has capacity to provide. We have improved our efficiency over the years, and we're able to serve more people in the last year than we have in previous years, which is great. But as I mentioned, still 67% of people seeking services are not able to be served. And so addressing that overwhelming need in our community is kind of step one of challenges for the system. So the next one is pathways out of homelessness. So going from homelessness into these different housing types, as well as shelter, we don't have enough of any of them essentially. And so until we are able to get funding and resources to put more people into housing, there's just not enough housing resources to address the need that we have in the community. And then Keith mentioned the lack of permanent supportive housing in our community and how it's at risk of funding cuts. So when we are applying for funding as a community every year from HUD, they release a notice of funding opportunity for us to apply for and get funding for our community. And last year, there were significant changes in policies and priorities. And one of those policies put a cap on the amount of permanent housing that we could have in our community. Thankfully, that NOFO, there was lawsuits and things like that. So we did not end up having to stick to those limits, but it's possible that in future years, we will again see caps to permanent supportive housing availability in our community. And so that will really limit our ability to provide housing to people who are perhaps the most at need. And so there's definitely threats of funding cuts there. So our exits are another challenge. So exiting to permanent housing, especially from shelters, there's not a lot of flow or people moving on from shelter into that permanent housing. Some of that is happening, and that's either happening through our system, they're moving into one of the other housing programs, or sometimes people are able to kind of stabilize in shelter and self-resolve and move out on their own out of shelter. But either way, the numbers are quite low, and a lot of people are moving from shelter to shelter or from shelter to street and are not reaching that permanent housing destination. And so increasing that ability for people to move on into permanent destinations from wherever they began. And then the next one is returns to housing. So we want to limit this as much as possible, because if people are just cycling back into the system over and over, that's just taking up more and more resources to keep that person housed. Or to rehouse them rather. And so we have had a lack of funding for stabilization. So once somebody is in their home, we want to be able to stabilize them so they can stay housed and not return back into the homeless system. And so increasing our funding and our resources to be able to address those stabilization needs that we have. So what is needed? How can we actually address all these different challenges within our system? So a lot of the demand that we see could be decreased through deep investment in prevention. And so the funding that we receive from the federal government is specifically for supportive housing, which is supportive housing is different than other housing programs in that it includes both the housing subsidy as well as the supportive services that go with it. So this kind of differentiates this housing from other like housing choice vouchers, which is formerly known as Section 8, or public housing. Those things are all housing subsidies to make them more affordable, but don't include the supportive services that come with supportive housing. So the funding that we receive goes to supportive housing, but we don't have a stable federal source for funding prevention. But we know that keeping somebody in their housing is much, much cheaper than housing them for years and years. In the prevention funding, the different pots of funding that we've had and the evaluation that we've done on that in the past shows that for prevention, we're spending about $1,800 on average per person or household that is receiving that funding. And $1,800 is like maybe a month of rent. And so if you compare that to providing a month of rent and supportive services for a year, the cost is just much, much lower in prevention. And so deep investment in prevention could help prevent some of these people from becoming homeless in the first place. Not only does that prevent, funding and overwhelm of the system, but for that individual and for that family, it also has significant impact on reducing things like trauma that people experience when they do become homeless. The next one is just additional permanent housing as well as pathways. And this could be innovative pathways that we are not currently funding or funding at low levels in our community, but creating additional funding opportunities and having resources, having the money to be direct, to be able to house more people in supportive housing. So next is housing destination. So how are people exiting the system? How are we able to get them into housing from wherever they started, whether that's shelter or one of the housing projects? And, this really links back to pathways out of homelessness as well as PSH, is having more housing available for those people to move into from shelter and from other areas. Increasing the amount of housing destinations that are available. And then the last one is stabilization. So we talked a little bit about this, but stabilizing people, this is really related also kind of to prevention, stabilizing them in their home once they're housed, to avoid them from re-entering homelessness after they've been housed. So these are just some of the kind of examples of how to address these things. So creating better referral systems. Pima County is working on creating kind of a homeless prevention hub, supporting reentry and stabilization, creating true emergency housing or bridge housing, which is a bit different than what our shelter system currently looks like. Offering more innovative options such as safe parking sites or safe sleeping sites such as Star Village that Keith mentioned. Creating more pathways into supportive housing, especially for people experiencing unsheltered homelessness. And then again, safe camping sites, safe sleeping sites, allowing people to connect to services in a more meaningful way. And then more permanent housing destinations, whether this is through landlord engagement, working with our general housing market, or working with our public housing authority. They're the ones that have authority over our public housing and our housing choice voucher program. And so working with the PHA to develop those referral pathways and work strategically together in our community. And next slide. And so when you're looking at homeless prevention and the different kind of options for homeless prevention, the Prosperity Initiative sits at kind of this high level of like universal supports, trying to lift our entire community out of poverty and increasing prosperity across the community. A primary method is promoting stable housing. So we have several plans in our community through the city of Tucson and Pima County to increase affordable housing, which we know is the #1 driver of homelessness. And so increasing the affordable housing stock in our community to prevent homelessness in general. And then helping with emergency rental assistance and eviction prevention to keep people who are already housed in their housing, helping them through a short-term emergency rather than allowing them to, lose their housing. And then we have other rehousing and stabilization efforts that are kind of the last tier of ongoing efforts to move people rapidly out of unsheltered and sheltered homelessness into housing. So I'm going to pause there for a minute and hand it to you, Keith, and if you had anything you wanted to add to all those slides.
Nothing to add. That was excellent. Thank you, Kat.
Okay, perfect. So moving forward, Keith mentioned the Tucson Pima Collaboration to End Homelessness. So we recently had a strategic plan that we adopted for the next 5 years that will be kind of our guiding document. So I want to talk through a bit about what that plan looks like, how it coordinates with CC4P, and also what is TPCH. So the Tucson Pima Collaboration to End Homelessness is our local continuum of care. And so this is a program that is required by HUD for our community to receive supportive housing dollars. And so what this is a coalition of housing service providers, faith-based partners, governments, and other community partners who all work together to make decisions about how funding is allocated in our community. We do a lot of regional planning, so our strategic plan, for example, but also creating policies and procedures for how the homeless system works. Service bridging, so connecting people experiencing homelessness to the services that they need, as well as running the coordinated entry system, which is the process where people are assessed and prioritized and then matched to housing programs. And so we're working really at the system level. TPCH isn't working directly with clients, but we're supporting the agencies who then are housing folks. So when we look at our strategic plan, we have 4 major priority areas. And so the first one is individual client experiences. So improving individual client experience within the homeless response system. Next is our staff and workforce and improving workforce capacity of the homeless service providers within the homeless response system. Next is TPCH kind of as a whole, so optimizing and increasing our efficiency within the homeless response system. And lastly, collaborating with our external partners on multi-sector solutions to impact housing and homelessness. So we know, we have supportive housing. That's what our funding is for. But the need and the issue of homelessness goes far beyond that. And so working with partners across the community to create those multi-sector solutions that we can be a part of. So when we look at those strategies that were mentioned to address these different gaps, our strategic plan that TPCH just adopted, we already have some of this. And so CC4P and TPCH are kind of two puzzle pieces of a bigger puzzle, that's not intended to be duplicative in any way, but some of the strategies and the actions that TPCH will be taking to address some of these choke points that CC4P has identified will be kind of a puzzle together of taking some of the actions and the work that TPCH is doing and kind of extending them and broadening them to really address these issues in our community. So these are some of the same kind of choke points throughout the system that I talked about before, but prevention, additional permanent supportive housing, improving pathways into housing, increasing exits to permanent housing, and then stabilization in housing. So some of the things that are already noted in the TPCH strategic plan to address each of these, I've listed here, so I won't read all of this. I know it's a lot of words on one slide. And you're welcome. I can put the link in the chat for you guys to see the TPCH strategic plan if you'd like to take a look at it. But some of the actions that we've already identified in there to address these different areas include, for prevention, just advocating for less restrictive prevention eligibility. There's a lot of different, as I mentioned, kind of pots of money throughout the community where they may be for kind of specific clients or specific populations. And so advocating for less restriction overall so that we can help a greater percentage of the population, ensuring equitable access to those prevention resources, and then also strengthening referral pathways to those eviction prevention services. And so working with partners across the community to really develop what are those pathways and how can we refer people to services and to funding. Additional permanent supportive housing, co-creating shared housing opportunities, working with our PHA as well, improving our pathways out of housing is engaging with groups who are already providing innovative housing options in our community. So we know there's a lot of housing that is not COC funded through the continuum, but funded other ways and may look a little bit different. But how can we tap into that and create one larger network, working with landlords and other innovative models? Next slide. Increasing access to permanent housing. So again, engaging with landlords, mitigating evictions, providing incentives for landlords to work with folks, working with our PHA again on shared housing options and just better referrals, and stabilizing people. So one of the things we've actually already accomplished is creating a prevention committee. So it's actually a prevention and stabilization committee. So we now have a TPCH committee that will be specifically focused on that work to improve stabilization support and increasing income for our clients, and just continuing some of the work we're already doing with our stabilization and house case conferencing. So that is it. I know we're getting close on time, so I want to hand it back to you, Keith, to kind of wrap this up.
Thank you so much, Kat. And now I think you can all see why I was so excited that Kat took on this job a couple years ago. I'm so grateful for your expertise and perspective on all of this. Okay, we're at the end here. We wanted to have a little more time for discussion, but I basically just want to say the next steps are we want to invite you to participate. We can put the little interest form in the chat again if that can be provided again. We're looking for guidance on how to do this work in terms of like how much participation is still substantive but still mindful of people's busy lives and obligations. We do at some point want to identify these problem-focused work groups. I think that will be a next step for our work. But I think the immediate task for me is to ask you all for help thinking about who are the other folks who are kind of not in the room, not in the conversation yet. We will have to let you know who we're already in touch with at some point to help that process. But to me, I'm really focused on that cross-sector piece of bringing in those other orgs and entities, especially like landlords and maybe some underrepresented communities that need to be at the table. And then eventually, I hope that that work can lead to specific solution identifications, provision of solution menus, and then the actual pursuit of funding to implement those solutions in practice. So that is the end of our presentation. And I just want to say again, thank you so much to everyone who was here. I'm so grateful to all of you for your time. And we have a little bit of time, and if anyone is inspired, we would love any feedback anyone's comfortable sharing. And if anyone else on the team wants to jump in, please feel free to add.
I would just share, if you want to volunteer someone who's not here or not part of the conversation, you could feel free to sort of tap their name into that form and just make a special note that they weren't here, but you really recommend that they become part of this conversation. And we'd be happy to do the outreach to touch base with them, not require them, but just let them know that their name was brought up and then share the conversation with them.
Any other questions, comments, thoughts? That was a lot of information. I got to give you that. Well, I don't see anything, but if missing something, there's so many things happening at once. I can't keep like chat versus other things. Otherwise, I want to thank the presenters. I didn't know Jenny Grable would be presenting too. What a gift we have. Isn't that wonderful? Um, I would agree, there's a lot going on. There's a lot of good information now to make decisions on. So it's great to see so many groups mobilizing. I was at a meeting this morning with Kat, and the question, there's so many things happening, how to braid it together and how to work together. And so it's good to see folks trying to pull all these different initiatives together. Because gosh, another plan. What would we do with another plan, right? If only committees ended homelessness, woo, we'd be done. Yes, ma'am.
Yeah. I'd like to, if we've got a few minutes left, can you quick start doing the roll call of what organizations you're working with? Because it looks to me like there's all kinds of well-intentioned people that don't know what they can do, and they're in groups like the Rotary, churches, and that there are people that you could be giving a version of this talk to, and have a sort of a recruiting person to see if they can be got up to speed, to just, put two transitional houses in their parking lot, or two permanent houses in their parking lot. But if you could tell them the ways that they can help, there are so many people out there that are just feeling frustrated about homelessness, and would like to help but don't know what they can do.
Thank you so
I
much for
think
that,
you're
Chris.
100% true. I'm not sure what the request is, but I think what you're saying is quite true. Keith, did you?
Oh, just
You said you were going
we
to
can be
tell
more,
us.
yeah, we can be more clear about who's already aligned, so that we can use that to identify people to target for outreach.
Thank you. Yeah.
And thank you, Kristen. This is our local hero, Dr. Olson Garwal from the Homing Project. Thank you so much for being here, Kristen.
Our local hero. Are you going to start wearing a cape? Is that?
No, hopefully our group is actually gonna get some people into a village that opens in the very near future, thanks to the emergency status of homelessness city is declared. That's made a big difference.
Yeah, definitely. Building anything, putting up a tent can take, anything you can
We,
build will take time.
we've got everything built. It needs to open.
Uh,
Um,
uh,
I
I
do
think,
have a question.
yes.
I don't have a question, but I want to introduce myself. This is my first time to speak on this meetings, and I really appreciate Dr. Keith effort to bring that together. I met him a couple of years ago at the foundation campus, and I showed my interest as a refugee organization. Not only we don't do resettlement, but we do microfinance, and we are a CDFI, and we were interested um, to basically provide any technical assistance that needed at certain level um, with this community. So I put my name out there. I already filled the form. I want to encourage other people that do the same thing, that maybe we can get together and see as a financial institutions what we can do to help homelessness, and what kind of what fits our capacity for us to provide services to you, and as a team or as a sub team, as a subgroups too. So I just want to put my a shout out for you and for everybody around, um, and we are happy to follow up with an email to see how we can participate, and we are happy to participate, and we want to participate.
Thank you very much. Appreciate that. I wanted to mention just at the end here for various nonprofits that someone mentioned, and I think Dr. Olson mentioned also this, what can people do? There are people interested in doing something, and it is often questionable, well, what can they do? How can they help? Some things get so professionalized, which is not a bad thing, but then people are unsure how to help. I know if you go to any of the websites, OPCS, which is helptucson.org, you go to Primavera, Our Family Services, TPCH, you'll find places in which you can volunteer and opportunities. I wish there was a more comprehensive list so you weren't going to different places. That might be something nice in the future. There are different areas have different capacity and different needs. But I fully believe that we will not make the next leap in reducing homelessness or ending homelessness unless we really have a full community effort and find a way to work together as a community with various interventions. We're never going to receive enough funding to do this as professional organizations, nonprofits entirely. We need community, no doubt. Awesome. All right. I think that's it. I'm trying to do this like looking at like I said, I was not intended for this. I didn't play video games as a kid for this reason. All right. So thank you very much. I appreciate it. You have a wonderful afternoon. This will show up on our website as a YouTube link, is so that you can watch it or send people to watch it if you'd like, or if you want to